Hey there, this is Dr. Hugh coming at you again, and today what I want to go over is a part of an organic acid test that starting to make sense to me. This organic acid test is very, very complex. There's a lot of intricacies, so you have to look at this test as a whole, and you got to look at not only the organic acid test, but you got to look at the person, you, if you've had the organic acid test, and correlate all these different labs together. So what I want to go over is a little tidbit that I really discovered today with a lot of discovery. And one thing that I try and do is, when you get these tests back, the doctor can call and have a consult. So for me, like the way I look at it, like there are so many intricate details on this test that these people, when you call them, they see thousands and thousands of these labs every single day. So they're actually really the expertise in interpreting these labs is the people that work there and see 1,000 labs. So today I was on a call and I really picked up what I consider to be a really, really critical gem, which makes a lot of sense to me. And this is why, one thing about my philosophy here is, I'm continuing. I always want to learn. Like, I'm never going to tell anybody, oh, I know everything, there's nothing for me to learn. If a provider says that to you or someone says that to you, that's just so BS. Like, my philosophy when it comes to your case or helping the community, fibromyalgia, Floxed, whatever it is I'm always on a goal to increase my knowledge, and there's always something more that I can learn and something more I can study. So I called today, and this is very interesting. So you see the lactic acid here. Now it's not hugely elevated, but if we've all went to work out and the next day we're very sore, that's a lactic acid buildup. Now a lot of people have chronic pain, whether it's in your tendons or your calves or wherever it is. Now what I'm going to really correlate here is the iron panel. Now this is a person that came to me and she already had some labs drawn, but you can see here what we're really talking about here is iron saturation. Now you can see here 15 to 50 is the range. So she's already on the low range of iron saturation. And then the most important marker, which is this right here, which is ferritin, the sweet spot for ferritin is between 40 and 80. So right now, you see the range there. The range is really large. So she's almost at the low range right here. So ferritin, what ferritin is, if you haven't seen any of my other videos on ferritin, this is an iron storage marker, right? So right now, looking at her labs, like I know that she doesn't have optimal iron status. And you need optimal iron status because what does iron do? Iron delivers oxygen to your cells. It delivers oxygen to your brain. It delivers oxygen to your intestinal system. It delivers oxygen to your tendons. It delivers oxygen to your Achilles tendon, right? So if you have suboptimal iron levels, which she clearly does based on functional labs, what can happen if you don't have enough oxygen? Just like working out, what happens in your muscles? They get sore. And then you have, guess what? Lactic acid buildup. So this correlation makes complete sense to me now that I've seen hundreds of these labs, and I call every time, and because you never know what I'm going to learn or what kind of gem I'm going to pull out. So I pulled this gem out. Actually, I got a few gems on her going over the lab. So this is totally makes sense to me. You have suboptimal iron. This is why you need to have iron checked. You need to have ferritin checked. You need to have a full iron panel, and these tests are cheap. Right? They're not expensive. They're not like an organic acid test where that's more expensive. To check your iron status and ferritin is very, very inexpensive. Now I get like the conventional system is not going to be doing this. And you need to check ferritin and the complete panel. And you also need to make sure that you're not inflamed because there's some intricacies on that. But clinically, this is where I'm trying to put all the dots together. So with her, I'm going to get on the phone with her today and we're going to problem solve. She has high lactic acid and suboptimal iron status. So we're going to have to work on these things among other things. So I hope this brought some understanding to you, some clarity that the lactic acid and suboptimal iron levels now go together. And with that being said, just remember is where there's help, there's hope. Take care. Bye-bye.